tamanui te rā e ki runga i a whaira wai heke mai ko te marangai waipuke tia ngā tiriti o te motu e te tangata e ki ka whiti ana tamanui te rā e ki maranga kia mau kia ita he runui he ruroa naruai moko te runei ha kia hakarongo te ao katoa wa he katoa te pā tirohia ngā whenua tirohia ngā moana tirohia ngā tangata wariro atu rā e ki ka whiti ana tamarui te rā e ki runga i a whaira wai heke mai ko te marangai waipuke tia ngā tiriti o te motu e te tangata wā e ki ka whiti ana tamanui te rā e ki paranga kia mau kia ita he au nui he au roa na tangaroa te au nei ha kia are te au katoa kua he katoa te wā me hoki haka murira ki ngā kupu o rehera toi tū te kupu me te mana toi tū te whenua bum bum
Kia ora, nice. Nō reira, kia timata tātou. Ka huri aki ki a koe, Jason, you can unmute. Mahau tētahi kupu hei timata wa tātou pō.
A tēnā tātou. A tēnā tātou runga no i ngā tuahuatanga o tēnei ahi. Me te tuku i ngā whakaaro ki te wā Hinengaro ki āia i tēnei wā. Kia tawai tōna marino ki rungi a tātou. Tātou hui ngātahi nei. Mō tō tātou nei whānau te take. Moi e, te tupua moi e, te tawhito moi e, te kāhui o ngā riki moi e, te kāhui o ngā taniwha. Tawhiwhi ki ngā tua, tēnā ia nā rangi nui ki runga, ko papatu nuku ki raro. Ko pare atu ngā kino te wā, ko pare atu ngā poke o te ahiahi. Kia mahea te aratakatu o tāne whakapiripiri tēnā ia nā te aratakatu o tā whaki te wānanga, tā whaki te waiora. Unuhea tēnei te pau o tapu ānuku, tēnei te pau o tapu ārang. Ka whakamau ki tai, ka whakamau ki uta, ka whakamau turuturu, whakamau wā kia tina. Haumi e, ui e, tai ki e. Ka tuku te rākau ki a koe rāwiri.
Kia ora. Kia pēnei iau te timatanga o tēnei pō e te tī e te tā. Tātou e hui a ipurangi nei i tēnei ahi, nau mai rā. Tēnei te pō kia kōrero tātou mō tēnei mate urutā. Kia kōrero tātou mō tēnei mate Omicron. Koia tērā e kore pūpū nei ki tērā wāhi, koia tērā ka poro whiwhitia ki tēnā rohe. Nō reira, tātou e tau nei, tātou e whakokotahi nei, tēnā koutou, kia ora tātou. Thank you for joining our webinar on Omicron tonight. We are starting on time, and I want to thank you, Jason, for opening us up. Our first part of our webinar tonight, our wānanga, is on caring for COVID positive whānau. And I'm really thrilled to have, I think, the 3 primary care practitioners who have seen more COVID patients than any others in these 2 years. It's my pleasure to introduce Dr. Mātere Harwood, Dr. Jason Tuhoi, and Dr. Lily Fraser. Hei o koutou.
Tēnā koe Raori. Mātere, here's our PowerPoint. So tērā pia, ka tīmatau. Tēnā koutou, ko Lily Fraser hau no Kaitahu. He tākuta ahau e mahi ana ki Turiki Healthcare ki roto tonu a Māngere. Nō reira, kia ora koutou katoa. Lily Fraser from Turiki Healthcare in Māngere. Ka hotu te rākau ki a koe, Jace.
Tēnā tātou no, ko tai mai, ki tēnei hui o tātou. He uri tēnei no roto hauraki, no te aroa, no ngāpuhi no tonu. He tākuta haupuri ahau i tērā wā ki Hapū Marae, engari i tēnei wā ko hunuku ahau ki Taranaki. Nō reira tēnei au e mihi ana, ki a koutou te hunga e mā taki mai nei. So I'm Jason, I'm GP, previously working at Hapū Marae in South Auckland and now working tomorrow down here in Taranaki. So tēnā tātou.
Does anyone have our slideshow?
Yeah, kia ora, we do have your slides actually, so we're going to get Paul to load them up and yeah, back to you.
Ka pai. Okay, next slide. Okay, so yeah, I think we'll just kick us off here. So obviously we've been in a really privileged position in Aotearoa where we have not had to deal with COVID on the scale that we're dealing with it at the moment in the past 2 years. So we've had quite successful public health strategies. That means that due to lockdowns and social distancing, all those things that we've been doing for the last 2 years, we've managed to really keep our numbers of COVID really, really low. And that's given us time to really get ourselves in our best position that we can before we experience the surge like we're experiencing for Omicron. So that has really allowed us to get as high a vaccination rate as we can. And there's been some really amazing efforts happening in different areas across the country to support Māori to get vaccinated. We know the kōrero about that and we're not going to go into it tonight. Needless to say, you know, for better or worse, we are still in a really good position compared to some other countries who've experienced these big surges. What we're seeing at the moment is that a lot of the struggle that our own whānau, particularly in South Auckland, are experiencing are related to poverty and those other kind of things that impact on the way that we have the ability to live our best lives, to have access to things like food, a warm, dry house, and have enough space in our house so it's not crowded, be able to get medicines or food in advance. And so all those things where whānau who have money and resource to be able to do that, what we're finding is, you know, our whānau, many of them are living day to day. And so the ability to prepare for something like having COVID and having to stay home becomes a real struggle. And so a lot of the mahi that we are doing at Turiki is actually supporting whānau with those types of things. So getting those care packs out to them as soon as they've found out that they've got COVID, delivering kai as soon as we find out they've got COVID. And then we have our clinical support as well. So if people are actually feeling sick or need medication, we have our nurses and our doctors available for that aspect of it. At Turiki, we run a testing station and we've been absolutely slammed through this surge. So we've had, you know, the waiting of the cars around the corner. The change to RAT test last Wednesday has really helped that for us because it has meant that the process is faster in terms of getting those out to people. It also takes away that delay because even if people don't have COVID, they can't go back to work or back to school if they haven't got their result. And we were seeing kind of up to 7 days delay in getting a swab result back in the last couple of weeks. And so being able to change to RAT test where you get a swab result quickly has really helped whānau just know what to do immediately rather than waiting for that swab result. There's been a big change where last time there was a lot of, you know, for Delta, we were calling whānau every single day, and if it wasn't Tūriki doing the phone calls, it was Healthline. There was always somebody there checking in on you. And now it's been a big swing of basically like you're going to get a text that you've got COVID, and then you may get support and you may not. And so it's quite a big change in the way that we are supporting whānau. And so we are fortunate at Tūriki to be one of part of the Māori hub that is supporting our whānau in South Auckland, Māori whānau in South Auckland when they have COVID. But that does mean that often we're the first people to ring them now. And if they haven't received the text, then we're telling them that they've got COVID. And so it's really difficult because across the country, everybody has access to different resources. So what we experience in Mangere might be different to what other people are experiencing in Auckland versus what you might experience in Te Kaha and in rural communities. You know, there's a big kind of, you've got to know your local stuff about what's going on. And some of it is really, really good. And some of it is really, really koretake. And you get the, you know, so that's one of the really hard things is that some places are getting really, really amazing care and others are getting nothing. So, you know, it's a really difficult thing to coordinate across the country. And I know that there have been some people really pushing to ensure that our whānau do get the support that they need when it's needed. Don't know if you want to add anything to that slide, Jace?
Yeah, just to add into yours, and it's good to see that Mātiri, we've got her online as well, because we both work together at Hapū Marae, and I know she's been there at the front line, and some same sort of issues that we've been facing as well with this particular variant, and that our whānau are sometimes waiting 5 to 7 days to get their results, which has really been hard because a lot of the whānau have just been waiting and calling, and we've been having to try and get in contact with them so that we could actually support them. And we are still making those phone calls, and sometimes public health hasn't actually been calling at all. And so we've become the only sort of point of contact for a lot of our whānau. And our whānau in particular know us, and they trust us, and they know that we are there to look after them because we've looked after them right from the start of the pandemic right up until now, and will continue to do so. And so I think, you know, having us in those areas, knowing our communities, being invested and being there to support them is important, because a lot of our whānau already have that the issue with the systems that have never really worked for us. So maybe Mātiri, I know that you're here now, you might want to add in a little bit more to that as well.
Cool, should we just go on to the next slide, because we've actually only got like 10 minutes left, so so just basically what this looks like for us in clinic. So if you've been to the doctor in the last 2 years, you would have seen the whole zoning thing. So if you come in, you're going to get some questions asked before you come into the clinic. And based on those questions, you're either going to be seen in the red zone or the green zone. We also try and do as much as we can by phone so that it minimizes the number of people coming in to the clinic. And then obviously still trying to do as much of our business as usual that we would normally do. So the things like our screening, people get sick for other things. And so sorting that out during this pandemic has been really hard. It's mean there's been some big kind of delays in people getting care for lots of different things, or even getting diagnosed with different things. So yeah, I think that it has been a massive change in the way that we work, but there have been some really positive things. I think doing a lot of calls with patients over the phone with our whānau has been really cool, and that's definitely made it easier for people to be able to get hold of their nurse or their doctor. But definitely we have felt the financial struggle from COVID, people losing jobs, and then having to have time off work if they're working, particularly if they're contractors. And so I want you to know that there is ways of supporting whānau out there. So at Tūriki we have a connection with MSD for WINS, but also we have a new contract that allows whānau who have had their income reduced because of COVID due to having to stay home and isolate or having COVID themselves, that we can actually support whānau with paying bills even if you're not on a benefit. So I think that those contracts should be around the country, and it is important, I think, to talk to your local doctor and find out what's available in your area. And definitely, yeah, we had a whānau the other day that had 26 people in one whare. So definitely crowding makes it harder for people to stay separate. And we see, a lot of people in one whare getting COVID. Next slide.
Kia ora, thanks, Lily. Look, Materi Yon, if you are able to unmute and come on in.
Kia ora.
Kia ora. Yeah, thanks for joining. Look, Materi, I introduced you guys by saying you three doctors Māori doctors have seen more COVID patients than any other primary care practitioners in the country. So your insights about what that looks like and how that's feeling with whānau, but over to you.
So I've actually got Jason doing the next couple of slides in this. We've been asked a lot around the new phase 3 and the testing and what happens if you're close contact, household contact, or have infection. So Jason, did you want to quickly talk to this slide and the next one?
Yeah, I think what this has proven from this particular this slide in the phase 3 is that it's made it a lot more clearer for our whānau, because last year during the data we had whānau who were repetitively in isolation up to sometimes 6 weeks, and it became very difficult, like what Lily was talking about, with whānau having to remain in isolation, some losing jobs and things because of the amount of stress and things that was on that particular whānau. And so it was detrimental to a lot of whānau in terms of the managing employment as well as whānau commitments as well. So this has made it a lot easier and a lot more simplified in terms of when a day 0 begins. For those who are asymptomatic, it begins at the positive test, and those who are symptomatic are those at the date of symptom onset. But it's only 10 days now, which is probably one of the key sort of issues, key points about this. It's no longer the 14 and whānau who become a part of that household and things are only isolating so long as they remain well for that 10 days, but they could do the RAT, which is the rapid antigen test at day 3 and day 10. So it has helped to reduce a lot of the burden on whānau who are in a lot of our whānau into multi-generational living with a lot of our whānau living together. Did you want to add anything else to that, Mātiri? I was just going to go on to the next slide.
Yeah, just to say that there's only household contacts now and infections. So close contacts, you don't need to be tested. And the other key thing is you don't need to be tested to come out of isolation anymore. So once you've had the positive test, that's it. Stay away for 10 days and then you can come out. So I think that's the other clear thing there.
And to add to that, you don't need a release letter. So we've had a lot of employers asking us for release letters. That's a lot of mahi for us that is not necessary. So if you can push back on your employers and say, look, the Ministry of Health says that we don't need, it's just self-release, we just do our time. Obviously, we'll do a letter if they really won't let you go back to mahi, but if you can try and actually have that kōrero with them, hopefully they're getting that message. But once you're done, so long as you're getting better, you don't have to be symptom-free. But if you are getting worse, then you need to talk to a doctor before you release yourself.
So next slide, please, Dawiri.
Yeah, so it's been important to follow up, and that's what we've been doing as well at Hapū Marae, and I've been doing some of that virtually for the last sort of 3 weeks, following up our whānau and making sure that we're making sure that they don't have any further symptoms at the 2 weeks. Because of the things that we're worried about, and probably a lot of whānau are worried about as well, as long COVID. And the other thing that we are sort of catching up with our whānau at the sort of 4 to 6 week mark as well is when that whānau, because some of them are asking about vaccination as well, and wanting to ensure that some of them are wanting to get it straight after they've got COVID. And you have to, when you're talking to whānau, you have to be clear about, we want to ensure that you've had that time of rest between actually the time that you've been affected to when you can get your vaccination. But it's also important to ensure, like Lily spoke about earlier, the other things that are still happening within whānau's lives. We can't let everything else go. We can't let diabetes become uncontrolled. We can't let any of the screening things starting to lapse, because we've already seen that as well with immunization rates. We've already seen that with cervical and with mammograms and things. So it's important that a lot of those things are still being talked about and managed, because those things are still there, and COVID's just something else that we need to really continue to monitor. Martiri?
Yeah, and just as we've put there, big study coming from international research, but that included Indigenous peoples. Long COVID is an issue. We don't know enough about it, I think, in terms of Omicron, so we will be collecting data on this. But to know that people are experiencing these common symptoms of fatigue, breathlessness, and you would have seen on the front page of the Herald today from the cardiologist, heart conditions for 6 months afterwards. So we do need to keep an eye on that. If any whānau are experiencing any of these things, please talk to us, and we can make sure that you're getting the right help. We might just go to the next slide then, Ngāwari, and just keep playing it. So just to let you know that in the background, we're doing a whole lot of other work. So we're working with our colleagues out vaccinating in our community on Saturdays and Sundays. Lily and the rest of us are doing media around addressing some of those really basic questions and concerns that whānau have around COVID, as well as you can see here, 2 of our panelists have had COVID themselves and have had to experience what it's been like, and some of the, I guess, the challenges that have faced both them but and their whānau in looking after people at home, and we've had to step in and support them around that. So we too are at risk for getting COVID. We've got 4 staff down in our own clinic at the moment who are now COVID positive, so that's put an extra strain on the rest of us who are still working. And we're doing this on the background of providing advice to the government, having protesters turn up at our clinic and throw eggs at me and accuse me of killing people with the jabs, and telling me I'm a dumb so-and-so for wanting to do the best for our whānau and our community. So just to understand that we're trying to do our best. We are keeping up to date as much as possible with everything that's changed and changing over this time. And so if we don't have the answer straight away, we'll try and find it with you. But to also understand that some of this mahi is being done on our own back. So you may have seen me out visiting whānau in South Auckland. That's my own car that's on the camera, that's my petrol. Those are my own masks that we've bought, and it's the same for Jason and Lily. We're doing a lot of this mahi because we want to keep our whānau safe, and so I've just asked that you continue to be kind to us. It is very stressful and there's a lot of mahi going on, so I just wanted to reiterate that we're trying to do our best in this challenging space. Next slide, please, Rawiri. And so I just want to spend a little bit of time talking about the fact that we need to ensure that we are displaying manaaki in our mahi. So the first picture there is of me and our nurse, Nicole. And so I was just going to talk about the fact that as Māori health providers, continue to provide excellent care as much as possible, work as a team. We have a huddle each morning where we talk about those things that are going on in our background, where we might have whānau, our children off who are close contacts or household contacts, and now we've got that in our own whānau. So understand that each of us might have some stress going on, but it is important to provide the best level of care, and so continue to wear that full PPE, monitor your care by ethnicity to ensure that you are providing excellent care to our whānau. That's the reason I did that audit, to make sure that we were doing that in Papakura and able to demonstrate that to our decision makers. Lily.
Kia ora. So yeah, I think just definitely self-care is really important. We were fortunate Turkey to get our new uniforms, and that gave us all a bit of a boost to look stylish in our scrubs. And I think it is just you know, there's information overload all the time. And so being able to step away and do something different with our whānau or do something creative is really important. Kia ora, Chase.
And just
Okay,
spending that time with whānau as well. You know, it's so important because, you know, they're the ones who, you know, you do this for, and also ensuring that you know, that you're still there, that you're still present, that you're doing all the things that you need to do to keep your whānau happy and healthy. Kia ora Rauri.
Yeah, I have to cut you guys off because I told everybody else I'll cut them off on time. You guys are amazing. What I really just want to notice is that the kaupapa is about caring for whānau. I think that's what's got us through 2 years. You guys exemplify that. I've got a couple of questions, real quick fire. You can't talk in paragraphs. You have to talk in bullet points. Well, some people are loving on you guys. They want to find out, is there an 0800 number for Turiki? Is there an 0800 number for Papakura? What are they going to do? Because there's 400 people on our webinar tonight and they're from all over the country. What do they do? Over.
Yes, there is a 0800 number for Turiki, 0800 for wellbeing. But ultimately, I think it is, you know, reaching out to your own providers around you, because we can't send kai out around the motu. But there are so many great things happening out there with different iwi, your local Hauora. So please just reach out to them.
And to know that they've also reached out to us. And so we've been doing webinars with them about our experience and how they can learn from that to ensure that they're providing just the same level of care for their own whānau.
All right, beautiful. Thank you for sharing that. I've got one more question for you, and it is, what happens if somebody else in the household tests positive during that isolation? Over. Yeah, so if somebody else tests positive, then they need to restart their 10 days. So if they test positive, the day that they test positive, if they didn't have symptoms, that's their day 0. The day that they get symptoms, that's their day 0, no matter when the actual swab comes back positive. So that person's got to start their 10 days, but the rest of the whānau, they stick with the first person. So if you're a household contact and you don't get COVID at home from the person that has COVID, then you just finish your 10 days. So long as your day 10 swab is negative, then you're good to go. Obviously, if you get sick after that, swab, and you know, if it's positive, you've got to start again. All right, beautiful. Ngā mihi kia koutou. Ngā mihi aroha kia koutou. Beautiful work, really appreciate it. We're going to move on. Coming up will be the Hauora providers support. We've got some opportunity to talk about schools. We've got some opportunity to talk about mental well-being. Our next session, though, is preparing a whānau plan. And for this, we've reached out to Tina Ngata and Rachel Thompson, who have been working in communities on the East Coast. And nō reira, ka mihi kia koutua, nau mai, haere mai, kōrero mai.
Tēnā koe. I'm going to do a quick share screen for us. O tira tēnā tātai kua whakarau I ka mai runga I te kaupapa te pōnei, te kaumaha, te kaupapa taumaha mo tēnei wā. Oh, here we go. Is it working? Can you see that? Is that coming up clearly? Kapai. Hopefully that's coming up clearly.
Yeah, beautiful. Oh, you can, yeah, now it's deadly as. Okay.
Kapai. Koe ara, ko te kōwhiori, te uruta kōwhiori. Nō reira tēnā tātou, ko tēnā ngata tōku ingoa, he mokopuna tēnei no te tai rāwhiti. Nō reira, ko hikurangi te maunga, ko Waipu te awa, ko Ngāti Porou te iwi, tēnā tātou. So yeah, we've been working and I've been really blessed to have had some really great, strong working relationships, both with Dr. Rawiri, some other fantastic people who have come to walk with us on this journey over the last few years as well. And certainly our whanaunga Rachel is one of those people as well. We're more on the kaimanaki side. Rachel has come in and helped us before some of the clinical stuff as well. But we have we've tried to develop as much of a wraparound service as we can, just to provide some context. We are in the very remote, isolated East Cape. It is about, from our furthest point, about a 4-hour drive to town. But because of our limited ambulance services, it's about at best 5-hour ambulance transfer to the closest base hospital, and about, yeah, as I said, a 4-hour drive to the closest pharmacy. We don't have doctors here. We have minimal clinical care, but what we do have are some pretty amazing superpowers in the form of kotahitanga, in the form of manaakitanga, in the form of kaiteikitanga, and so we have tried to capitalize on those as much as possible and create a really strong relationship with our clinical team. And I guess if there's one thing that I wanted to come back to throughout this, the takeaway home, is that it's a takeaway message is that it really is about those relationships, the relationships between your approaches, as well as the relationships with the other services as well. So we've attempted to have a really close clinical relationship, but our care package, which is kind of like what you can see in front of you that we've put together for our whānau, it just really works similar to a navigator kind of approach, where we have, you know, the kaimanaki is going to help them to navigate all of those social services. So this is what we show whānau. We say, you know, whānau, if you need your tank filled up, we got you. You need groceries, we got you. You need whare wānanga karakia at night, we got you. You need somebody to hop online and watch an online movie or play some online games with the kids while you have a bit of time out, we got you. If you need financial help or somebody to go pick things up, or if you just need someone to talk things through, then we got you as well. And then on the clinical side of things, we've managed to get our own kind of SIQ and work with our local DHB and health providers to kind of have that thing covered off. But one of the things that we are very clear about is that all of the clinical expertise in the world isn't going to make a difference if you've got a massive wall between that clinical expertise and the whānau. And for communities like ours, that wall has been significant. So that's where we've come in and have worked really hard to just try to connect our whānau up to those services. And so providing all of these services has meant that we've had to get a lot of these whānau plans done and to have them done early, because situations like ours, where they are so far away from emergency response and care, you need to be as prepared as you can be in advance. So that's included putting together whānau plans, and this is just one quick shot. We have an online Google whānau plan that people can do through Google Forms. We've also got the printed out ones that our kaimanaki go out and do at the households. It covers a whole range of different areas, include, you know, we want whānau to tell us if they have thought about, you know, who's going to look after your children if you get hospitalized, and who's going to look after, who's going to continue to go and visit Nan if Nan needs somebody to go and visit her the way that you have for the last 20 years. And a lot of going through those processes has actually helped people, it's provoked them to think about things that we're often just too busy to think about before. So going through that whānau plan process has just been really helpful to get provoke whānau to think about things that they might not have thought to think about otherwise. So yeah, we are well down the pathway of nearly having all of our households in our community complete their whānau plans now. It's got all of these other kind of corollary benefits, though, in that it's enabled us to think really carefully around what our house, it's enabled us to kind of connect as a community and think really carefully at a household whānau and Hapū and Marae level around what our needs are as a community, and that's had all of these other kind of benefits. A part of that, if you have a look at this slide up the top, on the top right hand side there, is that, you know, we hold these wānanga with our whānau around, well, what kind of kai do you need to get ready and maybe pre-prepare or have on stock for isolating, but also at the end of that we try to get whānau to think about everything that they might need and really encourage them to think about a wide range of services that they might need. Usually the first thing that pops into our mind is kai, you know, just drop off the kai and drop off the medicine, and that's what we think about. But once we start prodding into things like, oh, do you want us to like organize karakia sessions, and maybe your whānau from Australia can zoom in a couple of times a week and join you and stuff like that. And we've been really aware that for a lot of our whānau, you know, the mama or it's been a lot of the Hauora Hinengaro stuff of looking down for a time that has been really difficult for them. So we've been really encouraging them to think a lot about that. And yeah, just having some of those, as was mentioned before, some of those online workshops for our whānau as well, to make sure that they're aware. A lot of the feedback that we've had from whānau is that they're worried about what's going to happen with their income. They're worried about whether or not, if they isolate, if they'll still have their job. A lot of their employers also aren't aware of the support that they can get to look after their employees. So just, you know, making all of that information as accessible as possible through our kaimanaki to do all of those sorts of things. I'll zoom through because I know Awari's left me very little time to talk. So yeah, and then I guess one of the other things that's kind of fallen out of this, or that this has helped with, has actually been some of those really gnarly issues that the system at a large scale is not able to address, but we have particular superpowers at the hapori level to be able to address. Things like misinformation. So if you're continuing to have these kinds of workshops and pull whānau in and give them really good practical information that they want around, you know, just home care and what kind of drinks do you want, what kind of drinks are good for you at that time, what kind of kai is good for you at that time. That's practical information, but it's also, you know, in the background, restoring and galvanizing your relationship with them as a source of good, reliable information. And so when we start putting out other comms like this around getting people to think carefully about, you know, where are you getting your information about COVID from whānau? Is it reliable? Then that kind of helps us to kind of be a little bit more resilient against misinformation. And, you know, we can start to really have some of those conversations. Rachel hates me putting up photos of her, sorry, Rachel, but it's a great segue to you, by the way, which is, this is my final slide, which is just to keep on saying to them, you know, like things like, do you know that person that you're listening to, you don't even have a profile photo of them up, but you have been on a journey with us. We have been in the marae together, we've been in the wharenui together, we've been in wānanga together. Remember, like, we're the ones that look after you and take you the kai when you're not well. Remember this one, he's the one that came along to the wānanga, you know, Dr. H, she's the one that just lives up the road. You know these people, and these, and just restoring that sense of community with each other and being in touch with that sense of reality about the faces and the people and the relationships and the whakapapa that you know. And that does help to fight some of the more gnarly issues around this and disinformation at a community level as well. I think I've done that in 6 minutes. I'm going to throw it over to Rachel now.
Yeah, beautiful. That's a record-breaking effort there. Thank you, Tina. Beautiful kōrero. Let's go to the neighbouring tribe, and we've got Dr. Rachel Thompson. Come in.
Kia ora, ngā mihi nui kia koutou, I tai mai ki tēnei wānanga, tēnei hui. Ko Rachel tōku ingoa huri ahau no te whānau apa nei, and he tākuta ahau e mahi ana ki ko nei. So yeah, I'm one of the doctors who work here in Te Kaha. I'm just going to do a really brief and no slides kōrero. So taking over from where Tina was doing, looking at that hapū perspective, what we've done is an iwi over here, is we have an iwi response team that sort of has, over the last 2 years, waxed and waned, but we have people from our local social services, we have our local councillor from the district council, we've got teachers, we've got police, those type of people all involved in making some of the big decisions that that we might need to make that might not necessarily be the same as what the government is saying. And then we have a structure within that where the hapū reps, there's 13 hapū, and we have hapū reps, and we have regular meetings with those reps. So they feed back into their hapū hui. And so we're trying to get consistent information out. So that's sort of our general plan. We've got a really close relationship with our local social services provider. So it's quite easy. And I think that's quite a key thing. If your service has a relationship with the clinical service or vice versa, then it's really easy. So this last week, we've started getting cases. So it's, you know, we're preparing and writing plans and, you know, and now it's all real. And it's beginning to click in what we need and the things that are happening or not happening. One of the things we realized very quickly is we needed an 0800 number just for our people, because ringing Healthline is not working for our people. So we now have an 0800 number 8 to 8, 7 days a week, where our people can phone in and book a test, book a vaccine, ask a question, if they're isolating and something comes up, they can ask on that. And that's for either clinical or wraparound support services. And that's been great, but it's really busy. Other points that I would say around planning as a clinical rural service is get heaps of stuff, like get as many, all your paracetamol, your inhalers, all of that stuff ahead of time. Suss out your PPE and rats and those type of tests well in advance if you can, or when you can. I know that some of that is not easy to do. I think sometimes people are always looking for extra nursing and medical doctor hours, but we've found our healthcare assistants or the volunteers from within our community have just been amazing. And if you train them up, that saves so much of your time, you know, of the clinical staff. So am I about to be thrown out, Dave? Okay, so
you've got a minute. You got a minute, and then I'm going to interrogate you. Over.
Okay, so yeah, no reira te whānau, I think working really closely, clinical with Manaaki services. Obviously here in Upper Nui, it's quite easy because there's one clinical service and one Manaaki service, so we work with each other. But that can be quite hard. But also, please, please, please remember, your staff are going to get sick, and you need those backups. You need a plan for when your staff are sick, because, you know, at the moment we've got 2 staff isolating, and you really do need, how can they work from home? How can you run some of these Manaaki services from home? So like our local rūranga are awesome, but if they get sick, they've also got the Hapū reps and the Hapū response teams in every Hapū along the coast who they can feed into and who will pick up the mahi if need be. Also gives people a choice. Yeah, I think that's where the biggest issues we're having around drug and alcohol issues and making sure people have what they need to isolate. And some of our patients with mental health issues needing a lot of support. So those would be some of our thoughts from over here in Upper Nui. And kia kaha tātou, we can do it because we you know, Manaki's in our bones and we can look after each other. And I think that's where it's at. So, hei kona.
Thanks, Rachel. So I hear you talking about kind of having some backup plans and having some redundancy, because we know that some of our whānau are going to get ill and we've got to be able to share that load. So whānau, sharing with whānau, that's really important. Tina, I've got a question for you that came in on the Q&A. And so big mihi, there's 60 questions coming through the Q&A, but this one's for you. And it says, is this your own plan? And do we have a generic plan? I think everybody's liking on your plan. They'd like to know, can you share that?
Yeah, we're happy to share that. We can share that if that's okay. We could possibly put it through the rōpū whakakaupapa urita. Maybe I'm being a bit presumptuous, but we're happy to make that available for the whānau to fill out. It is, yeah, it's pretty generic. Some of the stuff actually that went into that plan, we got out of the checkpoints that we ran last year, and it was stuff that whānau were saying as the reason why they were out on the road. Because we were asking them, what is it that's taking you out of the house today? Oh, I need to go feed my pigs. Oh, I go visit my auntie every Tuesday, and I have for 20 years, and she'll freak out if I stop. And so a lot of that stuff kind of wound up becoming, working its way into the whānau plans as things for us to ask whānau to consider around the kind of support that they need. But yes, happy to share that. And just also to point out, and I'm going to steal some time here, around that, the mental health support and the stuff that Rachel was bringing, mental health support for our kaimanaki as well, and for our people, our frontline workers, because they're under significant stress and strain. A lot of clinical people are also under significant strain, but also this is new ground for a lot of kaimanaki, Hapū frontliners who have never had to carry the burden of life or death decisions before. It's a lot for them. So we've started incorporating some weekly counselling sessions with tohunga and stuff like that for our kaimanaki, that helps them to be able to identify distress markers in whānau that they're looking after, which is really important, but also is helping us to do a little bit of stress management for ourselves as well.
Kia ora. Thank you, Tina. Thank you so much. And so we're still running on time, but listen, really appreciate it. Uruta will be absolutely rapt to have your whānau plan template on our website. I'm going to get Eruera to type in the Uruta website so that people know where to go. Yeah, thank you. Look, we're going to move on now. This next session is on the Hauora provider support. And I'm reaching out to a couple of the Māori provider teams that have been legendary, really. So I've got Tarina Moke from Raukara Hauora o Tainui, and I've got Rangi Mārie, Hunia, and Tiara Gilman from Ngāti Whātua o Rākei. And if you guys can unmute and come in.
Kia ora tātou. Rangi Mārie and I were chatting, and we were kind of like doing scissors, paper, rock, and who gets to start first, and so that's me. So I'll just share the screen. All right. So just, I know we're on the clock, so I'll just quickly move. Kua wehe ki te atua whakahonorotia tō tātou, kingi tu heitia pōtatau te whero, te tuawhitu. Nō reira tēnā koutou katoa, pai marere. Kia hau nei he mokopono o ngā tūpono o te tai hauauru me te tai tokerau. Te taho taku pāpā no kāwhia moana, kāwhia kai, kāwhia tangata, te tumu o te waka o Tainui, te taho taku whaia ko tinana te waka ko te rarawa tiui no Puki Potoia. Ko Tarina Moke ahau, and I'm the CEO of Raukara Hauora o Tainui. Before I quickly launch into my kōrero, I just really wanted to give you a very quick context of Raukara Hauora o Tainui, and it is within an iwi context. So everything we do is actually underpinned by the values of kingitanga. In terms of our governance of our response, it is through Te Whakakitinga, which is our governance body. That represents tribal members of the 68 marae, and then also Waikato o Tainui Lands Trust. But in terms of the provider side, there is a number of providers which you'll see on that slide on the right-hand side, which are involved in the Waikato o Tainui response. But what's important in here also is our koiora strategy. So koiora is our iwi-owned and led hauora framework, which has actually been created through the voices of 1,400 Waikato o Tainui tribal members who want their own led health system. Our framework, the koiora framework, is based on the tongikura of Kingi Tāwhio, which is Te Tōku Awa Koiora, which means my river of life, each curve is beautiful than the last. So that gives you a context around in which Raukara is operating alongside the other providers and the marae and also the tribal members of Waikato o Tainui. So I wanted just to do 4 take-home messages, and I preface this with just the, I've really tailored this for the providers. So I don't mean to cause offence, it's not to suck eggs, but it's just really to reflect on what kind of worked, what are the front of mind things for me and for Raukara. So, and it actually dovetail quite nicely out of what Tina has talked about, and that's around manaaki of our kaimahi. So I think that does start with karakia, however you do it and how often you do it. The other thing I think for Māori providers is we've got to protect our workforce. Probably like all Māori providers, the issue I have is trying to stop our kaimahi from trying to work 24/7. So that's one thing. Thing is also is around clear communication. You know, at the moment, it's our kind of theme song, which started today, has been, it's based on that Queen song, Another One Bites the Dust, because we've got so many people, kaimahi, that are either isolating because they're household or they've gone positive. So it's about how do we provide support to our kaimahi in that that are going through that at this time. Similar wellbeing checks for our kaimahi. One thing I've noticed is quite a lot of our kaimahi don't have enough sick leave. And when you're trying to put kai on the table and pay bills, you know, you are quite anxious around having to go on leave and stuff like that. So we've made provisions for special leave to work on a case-by-case basis with whānau, with our kaimahi, and being really open to what's really going on for them. And then I think another thing for the providers is really you've got to identify the factors in which your organisation's got to pivot. So as your workforce fluctuates, how do you reprioritise your services? And then what things, where can you redeploy your kaimahi into other parts of your response? And then also you've got to talk to the funders to let them know so that you avoid clawbacks. So that's the first kind of take-home message is manaaki your kaimahi. Second one is plan, and then have backup plans after backup plan. Like what's been said before, who's your backup? So if you go down, or maybe when you go down and you have to isolate, who is your immediate backup? Again, it's around prioritising services. And then this big thing, I think for Māori providers, because we have whakapapa into our communities, into our marae, these obligations. And so we have to manage the expectations of our own whānau, of our own hapū and marae, but also expectations of the communities. And it's not an easy thing. But what I've also found is when you're up front and can tell them what you can actually realistically do, then you can find a pathway forward. And then the other one really is collaborate. You can't do it on your own. And I found our experience inside the Hauora collective we've been able to just come together and mahi. And it's exactly what Rachel said before, manaaki is in our bones. Third take-home message is know your shit. It's the right clinical and non-clinical information from trusted sources. And this is important. So I'm just going to say this, which is the University of Facebook School of Medicine is not a trusted source. However, I do understand with providers, we get bombarded with information coming from the DHB, PHOs, ministry, all sorts, and then half the time it changes within a couple of 48 hours, so it is hard to disseminate it. So I do recognise that, but I think it's really important to get the right information. And then I think it's the strong, clear Māori communications. I mean, there's a lot of Māori providers that would love to have communications, Māori, dedicated Māori communications, but we just don't have the infrastructure to support it. So it's about what's out there. I know as a provider of Waikato Tainui, we do have a strong Waikato Tainui comms arm who is turning information, all of this information into booklets that are tailored for our tribal members, our marae. And I think the final point on the know your shit bit is what can you live with? There's so much information and directives that we are getting from the government, from the ministry, from the DHB, from the PHOs. But I think this is about what sits well within your puku. If it doesn't sit well, and if you know it's not going to work for your communities, then don't buy into it. And then advocate strongly and clearly why it doesn't sit well with you and why it won't work in your communities. And use, uruta and other avenues which you have, whether they are political or if you can get into, the senior officials, get into their ear to advocate. I know it's not easy, but you are best placed to know what works in your communities, not the government. And they can't do it without it. And I think another great thing about the Māori response in this is that we didn't wait for permission, we got up and responded. And then the final fourth take-home message is this is our new norm. and our mindset has to be kind of like, you have to accept it. This is our new normal. But also, you know, it's hard yards as a Māori health professional, practitioner, provider, te mea, to look up and reflect on what we've all done since March 2020. But essentially, we've been at this since March 2020. Some of the rules have changed, but, you know, we're still going. And actually, just remember, really, for me, it's just around, we're actually better equipped now than we were in 2020. And also remember the journey which we've all gone through, either from an organisation, personally, professionally, and as a people, as a community. We've come a long way, and sometimes we forget that because we're just down in the trenches looking as far as our noses. The other thing with that is sometimes we've got to calm the farm. It is hard to watch the numbers increase, and it is even harder when so many of your whānau are isolating or have COVID, and your fear for them. But I think what we're good at is we're really good at crisis. And it's just to remember, yeah, it gets tough. But what is so great is when you get out into the community, how, for the most part, people are really good. And then the final thing, even though this is a marathon, it's not a sprint, unfortunately. And I think just finally, I just really wanted to reflect on what the Koiora Collective has done. You know, Kingi Tuheitia for Waikato set our response. But what has been inspiring, as I said before, is that we just got up and we responded. And also what has been great has been that providers, we've just come together and we've focused on the kaupapa. Prior to 2020, you know, we weren't all joined up, and I think that's fair to say around all providers. It's quite competitive. But what I've noticed since March 2020 is providers have come together to respond. And ultimately, I think the kaupapa is ultimately to protect our whakapapa. And finally, you know, for Waikato, for Raukura, is the memory and the recognition and the obligation around the legacy of Princess Tupuia. It is very cognizant for us to recognise what she did in 1918 in terms of leading the people around the influenza epidemic. And so we very much are part of that ongoing legacy, which she did, you know, 200 years ago. And here we are. And I think that gives us the courage and the drive and the determination to do our response. So, in final, nō reira, tēnā koutou katoa. And that's me. Over to you.
Kia ora. Thank you.
I'll just
Okay.
come off. Oh, how do I come off the share? Oh, yeah.
Yeah, thank you. And let me hand over to Rangi Marae. So, Ngāti Whātua Rākei, kai a koe.
Tēnā koutou, ko te tuatahi ka tukuna ngā mihi ki a koe, Jason, nau I tīmata tō tātou nei hui I tēnei pō. Ko ai tēnei, ko Rangi Marae, hui nia tōku ingoa heuri tēnei no Ngāti Whātua. Nō reira tēnā koutou, tēnā tātou. Look, I have the privilege of spending a couple of minutes talking about some of the things that we're doing here in Ngāti Whātua Rākei. Raori did say that Tiara Gilman was going to join me, but lo and behold, the site lead of our vaccination centre is outside my house cleaning the van that has got fish scales all over it because when she was delivering the fish, it spilt. So she will not be joining us today until she's managed to do that. But I think if I build on Terina's point, looking after our staff and being able to care for them and to be able to celebrate the amazing skill sets that we have amongst us as we've embarked on this pandemic is pretty important. We are really humbled and proud about the skill and just the commitment that a lot of our team have put toward this. So We have a team of about 170. We didn't have that before COVID. We probably had about 87, 90 staff, and we've nearly doubled, and much of that has been toward our COVID response here in Tāmaki Makaurau. If I was to think about the three things that we have taken, or our approach, there's three kind of kaupapa for us. One is around Hauora, the second is around Manaaki, and the other is around Hiki Wairua. And the three of those go in tandem. And I'll talk a little bit about some of the things that we've been doing in this space. With Hauora, we are doing a lot in the vaccination and testing space. We've got a testing station. You know, our team yesterday, they distributed over 4,500 RATS tests here on a Sunday afternoon, just down the road from us. We've got, I think to date, we've done about 60,000 dotting across Tāmaki since we've been open since June. So it's a pretty intense piece of work. But I think one of the most critical pieces here is that we've taken our approach with our old people. So it's very much being led by the kāinga and led by our kaumātua and kuia. And we haven't tended to have a whole heap of backlash about the way that we've done things. So we don't get a whole heap of protests and things on our kāinga, because how do you do that when you've got 92-year-old standing next to you saying, dear, make sure you look after us, and dear, make sure that we're kind to one another. That doesn't tend to come across us. So we're pretty lucky in that respect. I think if we were to look around the way that we've done the activations in that Hauora space, we tend to go quick. So if we find out that there's a case on a Monday afternoon, we'll be there that evening at the park, and we'll be standing something up and we'll be testing really quickly. So our people have become quite used here in Tāmaki. We're based predominantly in Orake. They've become really used to being able to respond. And so I've put up some of these things around the pop-up testing stations. We can go out and within an hour and a half, we can have over 100 people waiting in line to go and do things. Part of this is also about getting people to be planned and be ready. And so we started distributing these ideas around our ISO kits, or getting ready, our isolation packs, probably in Jan. The thing is that it's not until you get to this point, and so here on the kāinga and here across Tāmaki, we're getting smashed at the moment. Our staff are getting smashed. The people, the cases are really high. I was talking to Rawiri today. My gut sense is only about 15% of our people are actually reporting that they're positive, and the rest are not. And my gut sense of that is, even from my own house, I've got 2 in my house at the moment who are positive, and they wouldn't even go on my COVID record because they're struggling to get on. And these are 2 university students who you would say are digitally able, and they're able to kind of do that, but it's not, it seems to be a norm. I think that's, so for us, we've got to think about not just what we see coming through the MOH and DHB channels, but we've probably got to assume that scale and the spread of this is a lot bigger here, particularly in Tāmaki. When we've been thinking about Hauora, we have a tendency, and we tended to do that for the first kind of, the second part of the year, last year. We focused really hard on vaccinations and testing, but we've started to change our tact, and we started to do that really in January. And so we've got He Tauira here, which is a collaboration with Māori providers across Tāmaki to start a different conversation, to focus on not just vaccinations, but where it comes to our babies, to look at a year of wellness. And so when we have dotting events, or when we have kaupapa, we not only have, we not only do the vaccinations, we also are starting to include taringa, doing your ears, your eyes and your teeth. And you can see there on the far right, there's one of the activations we did here a couple of weeks ago. So for us, it's like we can't let this pandemic define who we are and how we go forward. We have to start to craft our own narrative. And what has been really nice is to see the way in which our whānau has responded to thinking a bit more broader about getting back to this new normal. So that's some of the things we're doing in the Hauora space. Where it comes to Manaaki, we have a nursery, and we are hoha of spending a whole heap of money buying food vouchers and or going to supermarkets to buy kai. So we have been growing our own kai for the last 9 months, and every week we're doing harvests, and whānau are coming to get their own greens from the kāinga. The great thing about that is that it provides employment opportunity. There's something beautiful about going onto your own whenua to get your own kai, and the kai is tasting really yummy. So there's all of those things, and they're predominantly led by our young ones. So we've got a good crew of young ones that are in charge of that. As well, in the top left-hand corner, we've got a team that are going out doing deliveries every day. So today, I think there was about 50. That particular vehicle did about 50 deliveries going across Tāmaki. So they're under the pump and they're getting smashed because of the scale of the need that's here in Tāmaki. Not only there, what we do know is that we also need to think about broader elements of manaaki than just health. And so what we've got here is our education kaupapa, our oha mātauranga. We distribute education grants from early childhood through to tertiary, and over the last month we've just distributed 1,200 education grants, because the reality is some of our families are really struggling with the transition back into kura. And that will allow people to choose to whether or not they take Chromebooks or whether they have a grant. What's really interesting is to see the scale. I'd like to hope that our children are digitally enabled because they are choosing the device versus the funds, so that they're ready to go back into the school environment. The other piece too is that we've also had to think about how we support those people that not only live in the rohe, but also outside of the rohe. And so there was one of the questions in the chat actually that asked, what are we doing for people outside of the rohe? We're just having to start about thinking about that only yesterday, to be fair. One of the things that we know that we can provide is that we can provide some of the clinical advice, and thank you to Rawiri and Anthony and Elena for all of the support to gear up our team to be able to provide that over the phone. We will not physically be able to get to those places outside of the rohe, but we're probably going to have to look at other mechanisms, predominantly around financial distributions, to be able to give people support if they're going to isolate in home. So we'll think about that over the next day and a half, and hopefully be able to do that. The other part is we're also being asked to support our families that are overseas. And so on the far right-hand corner, this is one of our young ones from living in Australia. And so they are connecting quite strongly to try and figure out how do they hono to the kāinga, as well as trying to offer support and guidance around some of their experiences early on, as well as us being able to provide them with some kind of support. So we have to think about the rohe as well as wherever people might be living across the motu and overseas. The third part for us really, and this has been significant for our team, and it has been hugely important for the hapū, is around hiki wairua. And so we are lucky and blessed that we have taken all of our cultural content online, and that's reo, tikanga, mātauranga, and it is going viral for us. So we are having lots of people participate in different ways and connecting with our people. I think the same thing too with hiki wairua, it's also about having comms. And so we've made a call that our comms are going to come back from our people that they have strong affinity with. And so out here, what you can see is one of our mums, mum of 4, and she's leading our collective impact team, and she's going, one is to say, hey, whānau, you need to do this, put this ISO pack together, and the next one is her kind of walking down the aisle showing you how to do it. So we're trying to make it really simple, really intimate, and really natural for our people, and that seems to be getting lots of support. And also these web series around not just about Hauora, we've got to think about other things. So what's the impact here? We've got Kawhina Woodman, and he's talking to one of our kuia around education and what we should be thinking about for our tamariki. For us as well, the majority of what we're doing is being led out here from the rohe and from the papakainga, from Morake, but equally we have been tapping into the experience of people that live outside of the rohe, and I think that's beautiful. So in this one here, I've put this in here because we have Pauline Hopa, who's coming from Taitokero, and she's leading a lot of our webinars. So for us, we're quite conscious that we need to normalise a conversation, not just here, but also outside, and we've got to try and tap into all of the talent that we've got. So that's us. I think perhaps the last one here is that we are we have normalised a particular way of behaving, and I think that's because of where we are and what we're faced with. Being here in Tāmaki is like a war zone, and we need to be able to behave and to act in a particular way. And we also live on a papakainga, and that means that we've got multiple generations living here, and we've got to keep the papakainga safe. And if we're doing it on the papakainga, we expect to be able to do that across the rest of the rohe. So we've tried to take that approach there. So having one of my nephews there, having Kiwa there, that was on the first day that the dotting became available for our babies. And he's there with his mum and his other 4 brothers and sisters. So because we're constantly putting that stuff out there, I just don't think it's becoming an unnatural approach for us. So that's me, and happy to take any questions that anybody might have.
Kia ora,
Kia ora, Rawiri.
wonderful. Thank you. I really appreciate that. I do want to just notice there's some questions specifically for you in the Q&A. There's a beautiful provocation from Ngāhuia Te Awa Kōtuku about, we've talked about whānau plans. I know that Elena's coming in later on to talk about some of the marae stuff, but your experience in terms of working with marae up here, just maybe a comment from you about marae plans, and then somebody, when you get a chance to type in an answer about the Ngāti Whātua beneficiaries, I think you should do that too. But back to you for marae plans for one comment. Over.
Yeah, look, I think what we've seen here is at a couple of levels. We've seen, for example, the South Kaipara. The South Kaipara are a combination of 5 marae, and what's been really stunning there is that the 5 marae have come together and they've developed their own plans. So I don't think there's only one way to be able to do plans. That's probably my point. The other thing about that, it's for us who are delivering a whole heap of services, how to be in service to the kaupapa of the marae. And I think from a health provision perspective, don't try and tell them how to do what they do. You just have to do what they tell you to do when they tell you to do it. And I think so. I think that's one part there. I think the second part for me is that we've also been actively, for us here at Ōrākei, the marae to us is the centre of the universe, and it becomes the base of where everything happens. So that is our safe space. That is where we have our pātaka. That is where we do all of our thinking. That is where we put a lot of our energy. And I think it helps to transform the way that we deliver our kaupapa. And then perhaps the last one, Rawiri, is that for us, we need to collaborate with all Māori who are leading out amazing things. So it's great to see Haere in here, and I'm sure there are others in here. So we are working with a whole heap of other urban marae as well to figure out how do we be in service to a shared kaupapa. So that's also about sharing resources and doing that at speed. So as one example, tomorrow we'll be going out and distributing a whole heap of things to about 4 or 5 different 9 different marae. So that marae have the ability to express their own rangatiratanga in the way that this kaupapa is led.
Yeah, beautiful. Thank you. So service, planning, preparation. Yeah, beautiful kōrero. Thank you so much. And that's a nice transition into our next part, which is we're going to think about schools and tamariki and kura. And so I've got with us tonight Marama Stewart from Tūhoi, and I've got Haere Rua, who's up here at Hoani Waititi, and I've got Māori paediatrician Dr. Danny Delore. So Marama, can I get you to come in and unmute?
Kia ora koutou. Ko Marama Stewart tōku ingoa and koe te tumuaki o te kura o Tāne Atua. So I'm the principal at Tāne Atua Kura. I've been there for about 3 years now. I'm guessing you want me to talk about the community event that I ran, Dr. Rawiri. So basically when all of this came about, we started running vaccination clinics in Te Mātātua, and they were coming a massive participate in anything that drive from Whakatane, and the majority of our kids wouldn't actually participate in sport without us running a van. So we realised that a lot of our community were unable to access vaccinations because they had to book in and they had to go all the way to town. Nobody gets time off where we are if you are well to go to the doctor to get a vaccination, and they were not providing vaccinations at the Taneatua clinic. So I spoke to Te Pūnoro Mātātua. They were fantastic. They set up a community vaccination clinic in the hall. Now that's half community, half school hall, and because we were very aware that there was a bit of fear, quite a bit of fear actually around vaccinations. So we advertised it and we tried to keep it very low key, make sure that everyone knew that, you know, the kids weren't being taken over there. This was for community members who needed to get their vaccines done and they couldn't get to town. And it went very well. But we also noticed that there were a lot of worried people coming in and answering questions. And when you're answering tricky questions while you're trying to vaccinate someone, it's not super easy. So the nurses tried their very best, but communication is a skill. That's why it's a degree. So the board of trustees actually said, wouldn't it be great if we could get some good communicators, good Māori communicators to come to our school? So we had this vaccination event, and the motivation too was that, you know, we're all free to make choices, but unless that choice is informed by good, accurate information, are you really making a free choice? Or are you making a choice based on misinformation? So in the end, we got 3 beautiful Māori doctors. 2 came from Rotorua and 1 from our Edgecombe. And we put on kai, we put on a bouncy castle, we had Te Pūnoro Mātātua inconspicuously kind of parked under a tree with the vaccination van. And people came with big lists. Like one lady I saw, she had 3 pages worth of questions, and the doctors didn't rush them, and they just sat and they chatted. Now, like, my aim was never to get people to go to the vaccination van. We just wanted people to be able to ask questions and answer their worries and then go away and think. I think I promise not to count, but only about 3 people left without carrying on to the vaccination van, and it just felt so good. And people even rang in, and one of the doctors was on the phone for 40 minutes speaking to this mum. So she said, I'm not sure if she'll get it done, but you know, at least I was able to answer a lot of questions. So that's been really good. And I think because our aim has never been about, as a school, you need to get vaccinated. It's always been about, here, can I help you? Can I give you information for you to make an informed choice? When it came to the masks worry, because the majority of our school, when we came back to school at the start of this year, were terrified that we were going to force masks on our kids and they would just suffocate, and 2, we would force vaccinate, which was just terrible. And we spent the first week just saying, no, we would never ever do that. They listened, and by week 2 we actually had 20 extra enrollments. It was like, oh my goodness. But I think the other thing is that I've always tried to be in our comms, being very, very honest, like, hey, we're trying very hard to be safe here, wear masks, and we let the kids settle first. We didn't actually force them to wear them straight away. Once the kids were settled in their class and felt safe with their teachers, the teachers would quite easily said, right, now's the time to look after each other, let's pop our mask on, and the kids have been fantastic. But we've just tried to always be there as support, because, you know, you would hope as a school you'd already have quite a... Off you go, darling. Sorry, it was my daughter. It's my birthday. She's got a birthday cake. So yeah, we've always just tried to be a space where people can get information, because we're a school, we're about education, Haere atu. Haere atu. I'll be there soon. And just be there for support. Now that we've got COVID coming through our school, and I tested positive this afternoon. I've been wearing a KN95 since the start of school, and I've still got it, and my daughter is positive as well. But so it's come through, but I've always said, listen, it's going to come through. Keep talking to us, we will get you support. And half the day I've spent dropping off care packs and kai to people in isolation, because they don't really know what to do, but they do know how to ring us and to message us. And it's been great to put them into contact with the service providers, because they trust us and they will listen to us. So yeah, I think that's...
Thank you, Marama. And nā mihi ki tō tamāhine. Kia koe hoki. So yeah, what a beautiful story, and thank you for sharing that. I really appreciate you saying support for each other. Real whakaaro Māori, beautiful. Build authentic relationships with the children, with the parents. So yeah, thank you so much for sharing that. And yeah, look, we're thinking of you as you go through your isolation. So ngā mihi kia koe. Ka huri ahau kia koe e haere mahau we te kōrero.
Kapa, tēnā koutou, ko haere rua taku ingoa. Ko te tumuaki kei te kura Hapū Marae Hapū Marae, ki tāmaki makaurau. Ia tani kia koutou. Kia ora everyone, my name's Hari. I'm the tumuaki principal at te kura Hapū Marae Hapū Marae out in West Auckland. Got my timer on, got 5 minutes. But really just, I guess I'll start on where we're at right now in terms of a kura. So really one of the aims when we came back was to do our best to keep our kura open, as challenging as that is. It really was a major aim of ours, and whether we succeed or not is another story, because it's a day-by-day event right now in Tāmaki Makaurau and in our little community, but even in the wider West Auckland community, the cases are coming time one after the other, just keep coming in. Our tākuta would have mentioned it, and some of our kaupōrero and Ngāti Whātua would have mentioned that the cases keep coming. But really, part of it, doing everything we can in terms of haumaru safety in the kura, doing the best we can. It's a whānau support thing. And, we had 17 plus weeks of our tamariki being at home in 2021. Up in Tāmaki Makaurau, and then of course our whānau having to be at home with them too. And so if we can avoid anything, we'll give it a go. And so it's a struggle right now, because we've had case after case after case after case. Today, already cases come up, putting things together. But I guess one of the things that really most kura need to have is really have strong leadership teams and groups in place. So we have what's known as a huaketo, which dates back to 2020. And we just work hard, work together. Hui o horere, everything's, it's just, if it's a last minute hui, we need to get together, And right now, with the situation we're all in at the moment, there's a lot of horere stuff going on, things changing continually, daily, by the minute, every second minute, by the hour, I guess. It's more so here in Tāmaki Makaurau, and it will happen throughout the motu. And so having the support of the likes of our tākuta Māori, the likes of our Māori leaders such as Rangi Māori and Waipareira, different organisations, having those strong relationships with the Māori leadership in your community, in your hapori, in your rohe, is really important. And to ensure that support comes to you, and then in turn comes to your tamariki and your whānau. And so in terms of RAT tests and having those RAT tests available, ready to go, having your people trained up. And so our people went up to Rangi Māori got them trained up at Rangi Māori Huni, up at Ngāti Whātua. And now people are just self-testing themselves. And so, and having really good systems in place. And one of the things about today, we kicked off today, and we have really good systems in place from different hui we've had as ohu huaketo, as the ka hui kaiako, and putting strong systems into place of different scenarios. And we were able to activate those systems and make things go a lot simpler, a lot easier today. But there were still things that we weren't prepared for, that you have to, so you have to have strong decision making right on the spot, make the decision on the spot and get on with it and move it. And so thinking on your feet all the time, strong communication with your whānau. So it's important that we're regularly having 1 or 2 zui with our whānau on a weekly basis. normally one, but if we need two, then we'll have two. If it's on a Saturday, if it's on a Sunday morning, we'll have that whānau hui. We'll call it, we'll make it, and our whānau will come so that we're keeping them informed as to how we're going to move forward. And then adapting yourselves as a kura, but not only as a kura, but as a community. So as a kura, you're driving the community, your hapori. You should be willing to do that as a kura, and willing to bring your hapori on board. So we whānau are regular. Since 2020, we're regularly meeting with our zui whānau. So, you know, it's something that all our kura should be looking at doing. In the vaccination space, we really jumped on board the vaccination space around August last year. Eventually sent 6 of us, 3 ex-students, recent ex-students, and 3 current kaiako to Rawiri to be trained up to be lay vaccinators. And so
I won't be long, darling.
whenever we have events on, we'll our vaccinators will be a part of that. And so our whānau would come in from the end of last year right through to now to see faces that they were familiar with. It's not so much the case with our tamariki. That's a different ture that goes with vaccinating tamariki. And so those are our own nurses. So we have our own kura health hub, which we scrapped for back in 2017, 2018. And we have a strong team in our kura health hub as well, but it's constant. It's like Māori, you said, the conversation around vaccination was constant right through from even the middle of last year. It was constant, constant happening. And we probably had about 12 events so far, vaccination events through our kura. And not only just for our kura, but for our wider hapori, and then of course the wider Auckland area people coming in and being a part of those vaccination events. And then we got another 3 planned for the next 4 or 5 weeks, and so Faisal was having an event manager that was a real left field thinker and out the gate thinker. And so our event manager, so we call it an event manager that coordinates our vaccination events, and real left field, real adapting to what the kaupapa is. And so if it's our tamariki, if it's our boosters, if it's our whatever it is, then she'll adapt the theme and the kaupapa to what's happening at that time. And so my 5 minutes is up. There's a heap more going on, but ka nui tēnā māku, he nui nā kaupapa, engari kia kaha koutou, ko nā kura, ko koutou te hapuri, ko nā marae ko koutou te hapuri. Nā reira, mā tātou, a tātou iwi e hāpai, anga whakaua. Tēnā koutou, mihi atu ana.
Kia ora, tēnei te mihi ake noa ki a koe, haere. And you're a really great vaccinator, really appreciate your leadership in doing that. Danny Delors, Māori paediatrician in Rotorua, I'm going to turn over to him. He's been really involved in some of the planning and thinking and advice around opening our schools safely. Danny.
Tēnā kai Rawiri, tēnā tātou, ko Ngāti Tūwhari tō te iwi, ko Danny Delors tuku ingoa, hei mātanga aro tamariki ahau. Kei Rotorua ahau e mahi ana. 3 minutes I think I can do. Paediatricians have been describing schools as an essential service, a lot more essential than a lot of the activities adults are doing at the moment. Not just educationally essential, but essential for health and well-being of tamariki. I've been so impressed with how kura have handled COVID mitigation, taking on responsibility of COVID planning. So ka nui te mihi ki ngā kaiako katoa te motu and Tumuaki for taking this on. And I think schools are doing a fantastic job at the moment. Just some medical points with Omicron. It's probably less than 1% of school-age children who will end up being admitted to hospital with Omicron. So the vast majority won't have a serious illness. I would never call it mild, but only a small percentage will be seriously unwell, and it's more likely when you have underlying neuro disability or immune deficiency. But what's really important is those non-vaccination mitigation strategies that are happening in schools. So that's a culture of mask wearing for year 4 and up. That is cohorting as much as possible what schools are doing, so that if there is COVID positive children, they've only been around a limited number of other children, and good ventilation. And what you're trying to do with ventilation is have fresh air coming in, clearing out the stale air, and always flowing through the room. So if you can set up your room so that fresh air is coming through the window and going out the door, that's perfect. And it's, you're trying to recreate being outside. Don't put fans all pointing towards the middle of the room. Don't have don't have air conditioning on that's not ducted, that's just circulating air around the room. That's not what you want. You want fresh air coming in. Some places are going to have air purifiers, and in the toolkits going out to kura, some places will be eligible or should be able to have CO2 monitors to check how much stale air there is sitting in a particular spot in a room. So those things are going to help, and that they are coming if you don't have them already. In winter, you've got to remember things like heat pumps. They're not ducted. It's not fresh air coming in. All of these strategies that schools are going to be learning about and taking on, it's a really good investment of time and energy, because if COVID becomes endemic, meaning it's going to be around a long time, doesn't mean it's not going to be serious just because it's endemic. The pandemic may be over, but there still may be serious COVID popping up all the time. We need to have these strategies ongoing. We need to have high quality rooms, high quality ventilation, and we need to be prepared for the next pandemic whenever that may come. So I'll stop there. Tēnā koutou.
Kia ora, Danny, and thanks for the plug. Everybody get their vaccinations up to date. I really don't want to get a measles epidemic with this Omicron epidemic. Danny, I'm going to get somebody to type into the question and answer. There's a kind of question, and it just says, I think you can help, and maybe Hare and Marama can help, but advice for kura when children test positive. So I'm not going to get you to answer in bullet points. I think you probably want to type a bit of a paragraph on that, but ka mihi kia koutou. Thank you so much for joining us tonight. The next session, ka huri aku whakaaro ki tērā taha o te Hinengaro. I've got Dr. Ainsley Cribsua and Dr. Hinengaro Elder just to talk us through some thoughts and reflections about mental well-being as we go through what's a pretty intense time of this Omicron outbreak. Ka huri kia kōrua.
Ke aku tuakana.
Ka pai. Kia koutou ngā mumu, oranga tanga o te iwi, tēnā koutou katoa. Kia koe, te kai karakia hei tūwhera pai tēnei wānanga ngā mihi nui kia koe. Nō muri whenua tēnei kuaka, nei a mihi karere kia koutou katoa. Kai a koe te wā, e hoa.
Tēnā koe. Tēnā koutou e ngā rauranga tirama. Ko ai au, he uri ahau o ngā iwi o Ngāti Maniapoto, o Ngāti Tamatera, Ngāti Kauwhata, e noho anau ki te tonga o Tāmaki Makaurau. Ko au he kaimātai Hinengaro, ko Ainsley Cribsua tōku ingoa, a clinical psychologist. I'm a clinical psychologist working in primary care in Tāmaki Makaurau. And Hinengaro and I thought we'd change things up a little bit and throw a few pārtai at each other. Hinengaro, tell us what are some of your top tips for Hauora Hinengaro and the mental well-being of our whānau as we collectively strive to cope through this pandemic.
Kia ora. Yeah, look, there's a couple of things I want to say and really want to tautoko some of the big themes that have come through already, which I think we're going to reinforce in our bit of whakawhitiwhiti kōrero. So the important thing for me in my various roles, I'm based at Starship at the moment in the Child and Family Unit and the Mother Baby Unit, and I've recently been working in the community. And like all of us, I'm taking calls and messages most hours of the day and night. So COVID's not only an infectious disease, it is a mental illness pandemic as well. And it's exposed all the inequities we were already working with prior to. So I think there are some particular features about this Omicron phase that are going to put additional complexities and pressures on, in particular, mental health services on our whānau from that sphere. But again, it's like looking at a diamond. We're looking at the same whānau issues played out through maybe mental health and addictions lens. So for many people, home isolation is going to be a feature of this next 3 or 4 month period. And understand, Ains, you're in that situation right now, as many other people have been on the call. So we're trying to be really practical. And I suppose I was reflecting on the kind of conventional mental health advice that has been given, not by Māori services, but it tends to give the impression that there's going to be one person in a whānau that's having an issue or having a problem and everyone else is fine. And we know that that's just not the case. The reality is that everyone in the whānau is struggling in different ways, according to their own histories and backgrounds and age and stage roles and responsibilities in the whānau. So I think a key thing is to communicate with each other about we're doing the best we can, and to try not to beat ourselves up too hard if things don't go according to plan. And I'm speaking to us as kaimahi as well, and as kaiako, because we need to be in here for the long haul. We've already been doing this for 2 years, and it's, you know, it's tiring. It's a very, the uncertainty is quite difficult to manage at times. So I think the first thing I put on the table with people is let's learn about what stress actually does. We're not designed for long periods of stress. Our bodies, our minds, our relationships, our way to it is really stretched. And acknowledging that, I think, is a key thing. And talking about what is stress and what does it do when it lasts for long periods of time. So it makes us tired, it makes us worry, it mucks around with our sleep and our eating habits, it affects our relationships, we're more grumpy, we've got less patience. We might struggle with decision making. And so you put all of that together that's been brewing along for the last 2 years, and you put people in an isolated experience in it, maybe quite a small home with not everyone has their own bedroom in our whānau, you know, so it's very challenging for people to actually isolate within a home. So for me, I suppose one of the key areas that I want to focus on when I'm having a wānanga with whānau is about preventing the development of mental distress. Definitely trying to prevent the onset of a mental illness, but also trying to prevent exacerbation of a pre-existing condition. So I think it's important to talk about all the efforts that we've made in the last 2 years, and to remind ourselves that this is temporary. It is still a marathon, as we've been told, but the marathon, this sort of phase of the marathon is probably coming to an end, maybe towards the end of the year. We can remind ourselves that home isolation is doing a lot of good, and we're slowing the virus down, we're helping other people. We know that for our tamariki mokopuna, that when we talk about how they help others, they are quick to help others. They want to put the mask on, as we also heard. So keep reminding people that they're doing something positive for the wider whānau, for the wider hapū, for the hapori. Stop doom scrolling. Have a media diet. Really be mindful that we as pakeke, as mātua, we are role modeling to those younger ones around us. And so unwittingly, we can actually be perpetuating a lot of anxiety that we're trying to reduce. Maybe one thing to do is to schedule worry time. So if you say to yourself, right, 4 to 4:30 every day, I'm going to worry then. And the rest of the day, I'm not, because I know I get to save it all up till then. That might sound a little bit weird, but it actually works. Try that. Plan something that you love for the future with the whānau and talk about it. Talk about that, maybe, describe the detail, make it real, make it emotional, because this is extremely emotional. I mean, I think about all the whānau pani over the last 2 years. I think all the people who are just hanging on by their fingernails. This has been a very painful process for many, many people. Talk to other people, reach out. We tend to put on a brave face, don't we? And yet we have to actually peel back some of that and find an honouring way to be real. And definitely we've got to use our cultural resources, our karakia, our whakapapa resources. We've heard from Tina and Rachel, and in the city in Tamaki, it's a bit more tricky to kind of bring that vibe, but we can, and we've heard also from Ngāti Whātua how they're doing it in the city. Maybe one last thing to say is that describing praise, having praise for each other and for our tamariki in particular when we're at home is a really powerful way to give feedback and communicate how much you love somebody. That's a rongoā. So when you're wanting the tamariki to do something, maybe you have to work at home for a bit, make sure that you're giving them regular doses of, hey, I noticed the way you set the table without me having to ask you the other day, or thanks for looking after your brother and showing him that game. That was awesome. Those little doses of describing praise are incredibly powerful when nobody has much privacy and people are trying to have a little bit of their own time. So Ainsley, I was reflecting on the fact that you work in primary healthcare, you're working with GPs, practice nurses, and community support workers. So what are you seeing in relation to the mental wellbeing of community since the outbreak?
Yeah, well, we are seeing increasing numbers of whānau experiencing distress, intense worry, hopelessness, and generally feeling like they're out of control and or disconnected. I was just reflecting today that the Ministry of Health did a survey in the middle of last year, and of the respondents, actually about 25% of Māori rated themselves as feeling lonely most of the time or all of the time. This was compared to 10% of non-Māori. And it made me reflect upon how, you know, as Māori in general, we're a collectivist people. We enjoy congregating. Collective celebration as well as collective grieving is so important to the social structures of our Ngai Māori, but as well to our collective psychological well-being. And I guess listening to you, Hinengaro, I wanted to reflect upon and say to our listeners today that it's a very normal human neurological reaction to become hypervigilant, or in other words, on edge, when faced with uncertainty and change. And we're seeing widespread change fatigue in the primary care space. As humans, we're generally resistant to change and uncertainty, some more than others. My husband, case in point, and even the most generally optimistic and resilient peeps. I'm thinking like the auntie or the uncle that we refer to as te toka tū moana, will begin to feel emotionally drained at some point during this outbreak. And this is understandable, it's predictable because of the widespread fatigue related to change, uncertainty, and for many, an inability to physically connect with loved ones and social activities that are really important to us. So that was just some of my reflections as you were talking, Hinengaro. I do think it would be really important for us, having listened to some of the kōrero prior by our kaimahi and our leaders of our kaimanaki, our kai Hauora, for us to kōrero a little bit about how do we care for the whānau that are caring for others? I mean, you know, you and I are in the business of caring. How do we awhi tautoko our frontline kaimanaki kai Hauora?
Oh, kia ora. Yeah, it's such a key issue, and it's something that I really care passionately about, because, you know, as others have said, we will run ourselves into the ground if we can. We work 24/7, we're available, and that's just who we are. And at the same time, we need to create some checks and balances for ourselves to stay healthy and to keep doing our jobs, be present in our roles in a safe way, in a safe, sustainable way. So one of the things that I've been doing a lot of is offering supervision, and I've been advocating for that at a national level in some of the work that Danny and I are doing with the New Zealand Māori Council, because I can see that, you know, supervision is like is pure gold, and it's really hard to get. Even before COVID, you know, I'm sure you face the same, and many others will face the same, getting calls and emails, oh, you know, where can I get a supervisor? So I think providing a safe space for people to actually offload and share what they're learning, you know, in that kind of a group, we know that gives the potency to the real I don't know, the sharing of the stress and the pain and the this relational superpower that we have, as you said before, is about doing it together and making sure that we don't leave anyone behind, because that's when people get lonely in their work, they get isolated in their work, and that's when things can come a bit unstuck. So for me, I think the supervision piece is really key. I actually think events like this, regular events where people can come in and out as needed and as they can find time, that's a way to maintain our own well-being. Because after all, we're asking other people to do it. We need to walk our own talk. How about you? Do you have some other thoughts about how we all collectively look after our own well-being as kaimahi, as kaiako?
Yes, and I'll just say 2 points because I know that Rawiri will cut us off shortly. But
Okay.
one of the things I'm often saying to our kaimahi is to be kind to yourself and cut yourself some slack. That's on the back of advocating to our communities to be kind and recognise that our kaimahi hauora are human. There are times that they will feel frustrated, resentful, exhausted over it, but they are doing all they can to keep us safe, to keep their whānau safe and do the mahi that's needed. And one of the key coping strategies that I am speaking to kaimahi a lot about these days is if you're feeling out of control, anxious, worried, hopeless, despondent, related to the circumstances of the time, take back some control. Accept that there are aspects of this pandemic that are not in your direct control and remain unpredictable. So create or build upon some predictability. Predictability reduces anxiety related to uncertainty. So routines are important for you and your tamariki. Have meals together in your whare if you can. Book in purposeful time to re-energize your wairua, whether that's connecting alone or socially and in a connected way, albeit in isolation or socially distanced, or sorry, physically distanced. And just going back to a lot of what our colleagues have said before, be prepared. Have your Omicron kit prepared in your whare, otherwise known as the ISO pack. And toilet paper, I mocked the toilet paper hoarders at some point. Then I was caught short when we went into isolation.
Right. So. I might say one other thing, if I may, Rawiri, which is about...
You gotta be quick though, because I'm not afraid to cut you off.
That's right. There's a lot of division. There's a lot of division in our community at the moment, and that's also perpetuating mental distress and is a risk for people using substances to try to manage some of that additional tension. So one of the things that I've decided to do, and I've had some wānanga with people at work about this, is to cut divisive language from my vocabulary. So any efforts that we can make to reduce the sort of them and us narrative, I think is a really healthy thing to do. So I just suggest that. Please remember that PTSD is a big thing that's coming out of COVID, and that there's some serious psychiatric and psychological consequences that are part of long COVID as well. So we do have to continue to remember that the physical and mental and wairua relational parts of this pandemic need to be thought about together. Kia ora. Beautiful.
Kia ora. Thank you for sharing that. So we're all in this together. We've got to look after ourselves. We've got to look after each other. Beautiful kōrero. I really appreciate some of the practical things you've said. Even that, for me, especially saying, let's notice the positive things. There's some really good stuff going on. That's beautiful. You two have generated some questions. I'm going to invite you to go over to the Q&A. And there were questions about resources and things like that. I don't know the answers to, but you two, I'm going to get you to dive into that. Beautiful kōrero. We're going to shift over now to Kapa Haka and sports, and really pleased to have Wiremu Mato with us. In a sense, I was interested in a whole lot of things. There's wakaama, there's Kapa Haka, there's just so much going on in our community, but thinking about, that part of our community. And so Wiremu's from Sport NZ and joins us now. Unmute.
Tēnā koutou e te whānau. Ko Wiremu Mato taku ingoa. No Waipiro Bay, whareponga, marae nui ki te whānau apa nui, toko Mari Bay, ahau, tēnei te mihi atu nei ki a koutou katoa. Me te mihi nei ki a koutou, e whakakanohi nei i a koutou anō. Koutou kei te muro o te ahi, tēnei ka mihi he kōrero whaketi noi o tēnei. Evening everyone, my name is Wiremu. I work at Sport New Zealand in a very small team called the Rautaki Māori team. And it's a privilege to be here and listening to the kōrero and providing some bits and pieces, hopefully, to the discussion. Now, I'm just going to try to share my screen, and it's not going to do that for me. That's fine. Okay. So wearing my Sport New Zealand pōtai, there's a couple of things that I'd like to identify. The first thing is on our website, on the Sport New Zealand website, there's a COVID-19 response page. And on that COVID-19 response page, you click into the COVID-19 protection framework and you scroll down into that protection framework, And there's a number of different sections in there. The sections include settings, overviews, and frequently asked questions about COVID-19 protection framework, and guidance on events and schools, guidance for schools and stuff like that. However, if you don't have that time and you're a wee bit impatient like me, there is a COVID protection framework table in there that you can go directly into. And it's a one-pager. It's a one-pager that gives you an understanding of how to deliver those particular events, the events that you're talking about. So within the organisation itself, myself and my team, we provide advice into those protection frameworks, but the questions that are coming out of our communities are directed towards particular sports, as you can probably imagine. So waka is a favourite. Can we do waka ama? So hopefully the protection table that is in that in our website will be able to provide you all with advice and clear advice, hopefully, as to what you can and what you can't do under the current settings. I guess some of the important things around the that particular table is it talks about this thing called a CPF category, and it's determined by either gatherings or events. And so that's one of the things that some of our whānau have had to get used to. And so, and then within that table as well, it looks at with my vaccine pass and not having a vaccine pass, and what and how that shapes up in sports events and gatherings. And speaking of waka ama, so if you are a waka ama fan, and I know there are a few waka ama people on this call, what we're asking people to do is just to go straight into the respective sports websites. And most of our Māori sports, such as waka ama, do actually have some guidelines around waka ama participation. What we do know as well, so I think just leaving that Sport New Zealand portai over there, what we do know is that physical activity and sport participation has been affected since the start of COVID. And the data that we're picking up currently needs to be a wee bit sharper with regards to Ngāi Māori nei. And so that's part of the mahi that we are doing within Sport New Zealand, within our little team. So, hoi noi te whānau, ko au tēnā, mehe pātai au, tēnā pātai mai. Otherwise, I will leave it there.
Yeah, look, I do have one question, Wiremu, and it's a bit broad, but I'm thinking about, you know, the challenges for waka ama crews, or the challenges for Kapa Haka crews, or the challenges for the touch rugby clubs, and each one's kind of been different. And as you say, we know that sports is pretty important. We know that the cultural connections is pretty important. And so it just makes me wonder, to what extent have we been good at listening to those groups and understanding what are their specific concerns? How do we support them to be able to be, you know, connected with community, because what they do is so important?
Yeah, it's really difficult, Dawidi, and it's a great question. The ability to balance out, if you look at our sports such as waka ama, such as maurako, and you know, rugby and netball, and the sports that we have high participation numbers in, they all still have to come under the guidance of the Ministry of Health and the Ministry of Education. So it's really, really tough. It's really, really tough, and I don't have an answer to your question. What I would say though is that I think it's very well known the benefits of physical activity, and so if and we do have some data on this, is that people have taken up other forms of physical activity. And so in lieu of rugby and basketball or whatever it is, you know, the room that I work out of actually looks out onto the street there. And since the start of COVID, I've seen a whole heap of families and a whole heap of new families walking past, taking dogs for walks and going for walks up Wairaka, up Mount Albert here, and around and about the place. So I talk about data because I don't know if that data is actually being captured well, and whether we can actually accurately say, well, be accurate with our physical activity data that we have.
Yeah, kia ora. And thank you for noticing that. There's been a lot of people going out for walks, and often it is whānau. So yeah, that's really interesting. You've generated a couple of questions too. So I'm going to invite you to go into the Q&A and help answer some of those questions. You know, we don't always have all the answers, but I think it's a really useful place for us to be asking questions. Ngā mihi hoki kia koe. Ka tī rā, i te whānau. We've got one last area, and it is a pleasure to introduce Dr. Elena Curtis to talk to us about this. Elena, this has been something that actually has really activated Urutā right from the get-go, is to think about how do we support iwi Hapū Marae during these, you know, really complex, challenging times. So I'm really glad that you've agreed just to talk us through some of this really challenging area. Ngā mihi, kai a koe.
Kia ora rawari, tēnā rā tātou katoa, ko Elena Curtis tuku ingoa no Ngāti Rongomai, Ngāti Pukeao he uri tēnei o te aroa waka, tēnā tātou katoa. Lovely to see everyone and see all whānau and friends here on the panel. I think this is a tricky one, and I'm going to get Tina Nata to come in as well and offer her thoughts at any moment now. But I guess just from my experience, in 2020, I was pretty vocal around arguing around the over-restrictedness of the government during the Delta outbreak, or before Delta, and then during Delta as well, around tangihanga, because of the importance of tangihanga to our whānau, and that actually there were ways in which funeral directors with, you know, appropriate support could actually support our whānau to do tangihanga. And I think that was a major assault on our tino rangatiratanga to actually take away our potential to do that tangihanga. I've flipped now with Omicron, because part of the work that I've been doing is trying to think about how do we actually, it's less about infectious control and it's more about saving Māori lives. So everything I've been doing, leaning into the work within ARFs, which is now sort of having a lie down and saying they're not doing too much because they've done so much for 2 years. And then we've now set up a Māori Regional Coordination Hub here in Auckland. It's really, you need to try and contain this. We've sort of lost it, right? We still should do some, which we've all been talking about, but everyone is confused. But now I'm really worried because we've had so many outbreaks on marae and through tangihanga processes that I'm worried about that's going to be really harmful to our whānau and our hapuna iwi, and that actually that's probably not the best way to go about saving our lives. That's probably more important, and that's just because of the infectiousness of Omicron. But I want to, so I've been working with my my whānau and hapū down at Osuiti, and we've come to a decision to prioritise saving Ngāti Rongomai lives and shutting the marae for now. But it is hard, and I'm really keen to have Tina's input on this, because the flip side of this is that that's just one space of our being Māori. That, you know, the marae is just one place, and we know that our whānau are going to carry on being Māori as and still do something somewhere. So then we get an outbreak at the church, or we get an outbreak at somebody's whare. So I'm mindful that there's no perfect answer, but I feel more nervous about opening the marae up and the difficulties of managing that. But I've also seen Nahuia's kōrero, so I'm sort of here going, help, who gave me this section? I don't want it. But I really want to acknowledge you, Tina, and hand over to you actually and get your thoughts as well. But kia ora rā.
Tēnā koe, e te toa kana Elena, o tira tēnā no tātou. Yeah, it is. It's a really challenging space for us to be in and discussion for all of us. I think the marae obviously has become really politicized, and it's become something of a political football right throughout COVID as well. And one of the things that we are kind of done the opposite flip is that we actually started off going, no, close all of the marae. And for many of our marae, they are still closed. But in that, we also saw that there are, as you said, quite a few whānau who, you know, what we're doing then, apart from some of the division that it causes and some of the cultural harm that it causes, and we're really mindful that, you know, ko tahitanga, and I'm not just speaking about this in kind of in a fluffy sense, ko tahitanga is a real tool for getting through this as a community. We need to be able to hold on to our relationships and have that, you know, I guess whatever people call it, social license or whatever, to be able to get whānau on board to listen to the stories and keep our conversations going around COVID safety measures. And so things that kind of do pull us apart, away from each other, can have real consequences in our COVID response. So we are really mindful of that. The other thing that we saw is that, you know, for many of our whānau, they live in very small homesteads here, you know, 1 to 2 bedroom homesteads, a tiny little lounge room. And so, you know, we started to come across the situation where we're going, okay, so what if we have 50 people who are fully vaccinated, as in triple shots, because we've had our wardens there to check their passes, not just the vaccine, the scan codes, but their passes, to make sure that they're triple vaccinated. If we are controlling the whakaeke times so that we only have 4 ekinga per day, actually, and we just have it one day, or we only have 1 ekinga. If we are making sure that they either have takeaway kai for their hakari, or that they have outside dining as well available. If we make sure that there is information going out on social media around what the expectations are, information that's also printed and handed out at the gate, information that's also seeded into the poikōrero and through the karanga as well. And interestingly enough, in our experience, it was the information that came out through the poikōrero that actually landed with people, because they read a piece of paper, they go, oh yeah, put it in their pocket, because they're busy thinking about what they're going to say. But it was when it was delivered through the poikōrero that people actually like, oh yeah, okay, no haere. And that stuck, and I found that really interesting. And so when we have all of these things, as well as, you know, for us, we also utilized testing as well. I wouldn't say that we've opened our marae. We just made this for when we came together, assessed the situation, said that it looks like we were going to have 400 people from around the country with no controls whatsoever, no protections whatsoever, all gathering at a tiny little whare, enclosed space. That was actually more dangerous as a gathering than having a small group of people with all of these rules and restrictions in place that we could control on the marae. So it's not just and we tend to move into the binary space of good marae, you know, open marae is good, bad marae, closed, you know, all of that kind of space, but actually having discussions around what risk looks like, because there's no safe way to gather. There is no safe way to gather. There's just managing the risk. And so, and if whānau catch COVID on the marae, if they catch it at a household, you know, that's just geography, just to quote Pretty Woman, that's just geography. So, you know, for us, we've just started having, you know, different conversations around managing that risk and what role and responsibility our marae have to manage the risk to our whānau ahakoa kaiwhia. You know, because it's not just, you know, we're there to look after and to love and look after the safety of our whānau, not to love and look after the safety of ourselves in the marae Aotea, to love and look after the safety of our whānau. So if we can step in and provide some safety as opposed to what an alternative might be, that's the conversation that we are having right now. It doesn't necessarily mean open for everybody. It's just a different kind of level of conversation for us. Yeah.
Yeah, thanks, Tina. This isn't a bullet point question, but anyway, because part of me is going, and to what extent is that risk manageable? So for instance, Hongi line, that seems to me to be a COVID super spreader event, doesn't it? How are you managing? What are the different approaches, I guess?
Yeah, so again, because if it's going to happen, if one of the things is that one of the decisions that we have to make when we're in that komiti space is it going to happen anyway? Are we able to stop it happening? And if we're able to stop it happening because of our relationships and our connections in that space, then yeah, we'll take that route. If the whānau are determined to go ahead and it's going to happen anyway, then what are the other kind of protections that we can put in place to try and reduce risk in those other spaces? So there's putting that information out on social media, there's printing it out on a handout that they get when they come to the gate as well, and then there's putting it into the pau kōrero, having the pau kōrero be briefed, and they put it into their whai kōrero, and they are very clear, we do not hariru, we do not hongi at our marae right now, and he tikanga aroha tēnā as well, and framing it as a tikanga aroha, because it's really easy for people to say and we had that, people who try to frame that negatively. So you're really clear around how the holding off of hongi and hariru is actually an expression of aroha and manakitanga and tiekitanga for your whānau, and you put that into your kōrero. And that was when we saw the most kind of, I don't like the word compliance, but that was when it was picked up on most, which I thought was really beautiful. It was, our pau kōrero, our tikanga actually hit it out of the park more than the printed resources, the social media, anything, because it happened there. It was the kupu, it was kua taki nei runga i te marae atea, and then so it stuck when it was delivered on the marae atea. So yeah, that was just one of the things that we saw when we stepped into that space. Yeah.
Kia ora. Ka hoki anō kia koe, Elena.
No, I'll just say, I think, thanks Tina for that. And I think working with my whānau, like every marae has a different story about how much, resources they've got and who's available, and everything seems to fall on the same whānau that are down doing the ahika. I'm sitting up here in Auckland trying to give them advice. So I think it all depends on how much resource you've got for your marae, how not so much connected, but whether, how much you can do to be able to control that. And that, some of our whānau are pretty sovereign. So we managed to get away with muriwai's tangi at Ngāti Pukeao just before, I think, the surge happened. But, if that was again now, that could be a lot different story. And we just had a gathering of koike who have became a mini outbreak down Ngāti Pukeao too. So it's just around, I'm still really nervous, but I hear your kōrero, and yep, I think we just got a bit more flexible with everything, and if we can do that, then that would be awesome. Kia ora.
Yeah, I think it's a case-by-case basis as well. It depends on who's available, depends on the kaupapa, depends on the taonga tūpāpaku, depends on, it really is a case-by-case basis.
Okay, ngā mihi kia kōrua. Thank you for sharing that. Again, it's one of those things that's generated some questions and some comments in the Q&A. Just invite you to go over there and answer some of those. I did listen to Hinengaro saying we should do this regularly, so I've provoked everybody. There's still 300 people here at this time of night, and said, all right, if we were doing it again, what are the things you'd like to hear about? And so some people are typing that into the Q&A. Really appreciate that. I want to thank all of the panelists and all of those who joined the panel so you can answer the questions. There's hundreds of questions being answered, and I appreciate the time and effort you've put into doing that. The team behind the scenes who set this up, ngā mihi. Ngā pai o te māramatanga has been a staunch supporter of Urutā, and we really value their support. And Wero's sponsoring tonight. I'm going to close myself out with a couple of slides. Just look, any Māori providers who I just want to make sure that everybody knows that you need to get busy and get organised and get the PPE that you need. And if you need to order rapid antigen tests, there's a few steps you've got to go through. So if you need to find out about this, get busy, start logging into those systems and get organised so that you can get those things that you need to support your whānau, your community, your marae. Hoi anō, ko tāku, he mihi ki au koutou i whakarongo mai nei tēnei pō, he mihi ki au koutou i awhina tēnei pō nā kōrero. Ka huri anō ki a koe Jason, mā haupe e whakakapi wā tātou kōrero hei tēnei pō, tēnā koutou, Tēnā koutou, kia ora tātou katoa.
Tēnā koe otia, tēnā tātou. A tātou ko tai mai ki tēnei wahanga whakamutinga o tēnei hui. A topa nei. Nā runga noa te whakaaro, ko te oranga o te tangata, ko te oranga o te whānau, ko te oranga o te hapū, ko te oranga o ngā iwi puta no i te motu, te mātāmua o ngā whakaaro. Nō rei, nā runga noa i tērā ka tuku te reo runga mai whiti ki te wāhingaro, kia whakawātea tātou, kia hoki atira tātou, kia o tātou whānau, kia rena te taukāia kei wainganui a tātou anō. Nō reira, kia tau ngā manaakitanga o te wāhingaro ki runga ki tēnā o tātou. Kia māhea te hua mā kihi, kia toitū te kupu, toitū te aroha, toitū te mana motuhake, toitū te tino rangatiratanga, toitū te oranga o te tangata. Ka turuturu, ka whakamau wā, kia tīna, haumi e, hui e, tāi e. Kia ora rau.
Ana tamanui te rā e ki runga i a whaira wae Heke mai ko te marangai waipuketia Ngā tiriti o te motu e te tangata e ki Ka whiti ana tamanui te rā e ki Maranga kia mau kia ita He ruroa, nā ruai moko te runei ha Kia hakarongo te ao katoa, wa he katoa te pā Tirohia ngā whenua, tirohia ngā moana Tirohia ngā tangata, wariro atu rā e ki Ka whiti ana tamaru i te rā e ki Ki runga i a whaira wae Heke mai ko te marangai waipuketia Ngā tiriti o te motu e te tangata wā e ki Ka whiti ana tamanui te rā e ki Paranga kia mau kia ita He au nui, he au roa Nā tangaroa te au nei ha Kia are te ao katoa Kua he katoa te wā Me hoki haka murira Ki ngā kupu o rehera Toi tū te kupu me te mana Toi tū te whenua Daram daram